Welcome to week 2 of Women's Wellness Wednesdays. This Golden Valley Health Center's project is funded in partnership with EMC Health Foundation. Remember, you can win a great women's wellness swag bag by sharing this content and tagging a woman you care about. Welcome to your 70s, 80s, and better. Let's talk about how to help you live your healthiest life. The information provided in these slides is adapted from the Department of Health and Human Services Office on Women's Health. Not all of this information may apply to your life. Golden Valley Health Center's providers are available to help you get personalized health care. Call or text us at 866-682-4842 to schedule an appointment today. Let's talk about things that you could do each day to keep yourself healthy. You could choose to focus on one thing each day or work toward doing all of these steps. Eat healthy foods. Use the MyPlate plan to get started. Go to choosemyplate.gov for more information. Get at least 30 minutes of physical activity per day. Each week, do aerobic activity and exercises to improve your balance and strengthen your muscles. And talk to your doctor about any conditions that limit your ability to do regular physical activity. Get at least 7 to 8 hours of sleep each night. Reach and maintain a healthy weight. Get help to quit smoking or don't start smoking. Limit alcohol use to 1 drink or less, and don't use illegal drugs or misuse prescription drugs. Wear a helmet when riding a bike and wear protective gear for sports, and wear a seatbelt in cars, and don't text or drive. And finally, there's a lot you can do to stay sexually healthy at any age. Limiting the number of sexual partners and using a condom each time they have sex are 2 great ways people help protect their sexual health. Let's talk about information that may be important for you to share with your provider at your next Well Woman visit. A Well Woman visit is a yearly preventive checkup, and it's a great time to check in on how you're doing, how you'd like to be doing, and what changes you can make to reach your health goals. Talk with your provider about your weight, height, diet, and physical activity level, and talk about whether you use tobacco, alcohol, or drugs. Talk about any violence in your life, and please talk about depression and any other mental health concerns. Talk about who will make healthcare decisions for you if you become unable to make them for yourself. And finally, please share your unique story with your provider so that they can understand what makes you, you. At your next Well Woman visit, your provider may recommend the following tests, medications, or vaccines. The decision to get any medical test or procedure at any age is a personal one between you and your provider. These recommendations may not apply to every person. Your provider may recommend that you have your blood pressure checked and have a test for cholesterol, colorectal cancer, diabetes, and hepatitis C. Your provider may also recommend that you be tested for lung cancer if you smoke now or if you've quit within the last 15 years. Your provider may recommend a test for osteoporosis, and everyone should have at least 1 HIV test during their life. Your provider may also recommend that you be tested for sexually transmitted diseases if that's appropriate for you, and may also recommend that you have a mammogram or a test for tuberculosis. Your provider may recommend certain medications for chronic disease management if you have a chronic disease, and your provider may recommend that you take medication for urinary incontinence. Your provider may also recommend certain vaccines such as the flu shot, or hepatitis A and B, meningitis, pneumonia, shingles, tetanus, diphtheria, and whooping cough. Check out our other videos this week for women of all ages. Remember, you can win a great women's wellness swag bag by sharing this content and tagging a woman you care about. Schedule your appointment today by calling or texting 866-682-4842, and thanks again to our partners at EMC Health Foundation.